My name is Lori. I work with Dr. True. I'm one of his nurses, and I turned 48 this year, and I've started to see a little bit of the loss of the volume under my eyes. It really shows up in pictures, some shadows, and a little volume right here. So some of the things I want to do today would be the Plasma Rich Platelets PRP treatment with a little bit of Juvederm mixed together to kind of build up that loss of tissue under my skin. Also in my temples I've noticed, so a fuller face to just look a little bit younger. So I'm going to work with Dr. True today and see what he could do to help me maintain my youth.
Okay. I'm Dr. True. Today we're going to do a PRP lift on this patient as one of my employees, and we're going to fill up the areas that's a little deficient with volume. Now she's gorgeous as it is. We're going to make her a little bit more gorgeous. We're going to fill up the temple area, a little bit underneath the eyes in what we call the malar area. Use PRP, which is platelet rich plasma. We'll get some blood from her, spin it down, and then re-inject it into her face in these areas, which rejuvenates those areas. In addition, we can use a little bit of Juvederm or some sort of hyaluronic acid filler to help in lifting that up and increasing the volume. So the first thing we're going to do is to get some PRP, get some blood from her.
All right.
Okay, here we are. We're going to get a little blood on Lori. Just going to squeeze the ball. We're going to get some blood, and then we'll get to spin it down.
Hydrated, squeamish.
I'm a little squeamish, but I'm going to be a big girl because I want to be beautiful. It's not so bad. The price of beauty, no pain, no gain, right?
So take a deep breath, right?
Okay. Oh, that's not bad at all.
No.
She's good.
Well, I don't
And you can feel
blood
it.
yet. Nice.
Getting it?
Good blood.
A little blood. We get the blood from Lori, and then we can spin it down.
I think that's
Doing okay, Lori?
now.
I'm good.
Awesome.
We're going to spin Lori's blood for her PRP and our lab right here. Premises. Push the button, and there she goes.
Here's the Juvederm. This is the filler we're going to use. In addition, we see a cannula right next to that. There is a micro cannula that has a blunt tip to it, so we'll get less bruising from that. Then we have a little calcium. Calcium will mix with the PRP, get a thicker type of substance and give it a little bit more volume. So here's the PRP. Here's Lori's PRP. We're going to get some of the top part of this, re-inject it back into her face to give her the PRP lift. Okay, so the first thing we're going to do is to numb a little area on her cheeks where we're going to introduce this small blunt cannula. Usually we go right in this area here, just a little poke right in this area here. A little poke, and we numb it up. That gives us a little area where we can insert the blunt tip cannula. Get a little starter, just a little starter. We have the cannula right here. We're going to introduce it inside. Okay, just like that. And it will go inside. Be very careful because this cannula is just a very blunt tip cannula, so it won't cause any problem as far as bleeding. The bruising is much less if we use this type of a cannula. And if you have a sharp needle, if you have a sharp needle, that does a different thing. So, you doing okay?
Yep.
All right. So here's our filler. This is the hyaluronic acid type filler. And we just go underneath here and just give her little teeny bits. Little teeny bits. You okay?
Mm-hmm.
Little teeny bits here. Just give it a little bit of film. Not too bad, is it?
Nope.
Doing great. Doing real good. Doing all right?
Mm-hmm.
Now she wanted some right in this area too, in the temple area.
Yep.
And in the, what they call the malar area, which is right in here. She doesn't need a whole lot there. You need to put a little bit underneath.
I'm sure this looks a lot worse than it feels because I don't really feel anything.
You really don't. That's wonderful.
really not bad. Okay. So we've filled up a little bit here, just giving a little bit of volume.
Okay.
Yay! And then, okay, so we did that side. She's going to hold the little sponge there. She has a little bleeding on the point. So we're going to do the same thing on this side. Just a small little poke hole here. Okay, we've given her a little bit of lidocaine where it's the starter hole. I'm going to put a little poke of a needle in here, but now this is numb. It shouldn't hurt. Did that hurt?
Nope, didn't even feel it.
Shouldn't hurt.
Did you put something in there?
Yep, a little needle. Material. Again, we're going deep. And we have to be careful with the cannula. As it goes in, we're not trying to poke anything or force it in because we don't want to cause any extra bleeding. And we just deposit little teeny aliquots all along here, just to kind of fill these areas up. You hurting?
No.
Just kind of flinching once in a while.
Yeah, it doesn't hurt though.
Okay. Just kind of feels kind of
Feels weird, but not painful.
Not too bad. Okay, so that was the filler.
The nice thing is it's numbing as the filler goes in, so I don't feel anything.
That's right. The PRP, that's the platelet rich plasma right here. Now we're going to activate this with a little calcium chloride. Go through this small little poke hole here on the side that we made earlier. And we go in the same areas, but now we deposit her natural plasma in these same areas. And we can get way up and high, what we call the teardrop area, and fill those in nicely. And this will give her a little bit more tissue. What's going to happen over the next few months, her tissue is going to be stimulated to grow in these areas. So we get to do about 3 cc's per side. Okay, hold that right. Do the same thing on this side. About 3 cc's, we're going to deposit the PRP. This is her own platelet rich plasma, PRP. Deposit all along these areas here and fill them up. How are we doing, Lonnie?
Good. Don't even feel it.
One of the good things about the Juvederm is it has lidocaine already in it. And so it kind of tends to numb it up. So right now she's not having a whole lot of pain because it's already pretty numb. The whole procedure is not that painful. Well, the procedure might take about 10-15 minutes to do. And we're done. That's what we call the PRP lift. See, these are bleeding. Good.
No pressure.
Perfect.
I'm sure that looked a lot worse than it felt because it wasn't that bad and I'm a baby. So
I know,
Yeah.
they look great. No, I don't think it looked bad, but hopefully not. You look gorgeous.
Yeah.
Gorgeous.
thank
Fabulous.
you.
All right,
Yeah.
that's it. The PRP lift. So here's our patient. She looks gorgeous. She's got nice, pretty fullness of her cheeks. Now the idea of the PRP lift is to put PRP, platelet rich plasma, into the area. By doing that, the platelets release growth factors. So over the next few months, the growth factors are going to stimulate the growth of her natural tissue, her collagen, her elastoblasts, the different parts of the skin to give her even more fullness. So it doesn't happen right off the bat, it happens over the next few weeks to months. And she's going to continue to maintain this fullness. So she has the Juvederm, which gives her the scaffolding to build up that tissue, plus the PRP that stimulates her natural growth of tissue. And that's the PRP lift. I'm Dr. Robert True. Thanks for watching.
Thank you, Dr. True.